Begin to talk about the heroin and prescription drug epidemic that has gripped our country, is affecting every single state represented in this body. Sadly, it's a problem that is getting worse, not better. And I say that having been in Ohio this week, in Dayton, Ohio, where sadly we had 15 people overdose in the space of just the July 4th weekend, one city in Ohio. This is happening all over our country, and it's an issue that we have to address. And the federal government has an important role to play. There's much more we can do. This body recognized that when, back on March 10th, we passed something called the Comprehensive Addiction and Recovery Act, CARA. CARA was on this floor for 2.5 weeks. And there was some back and forth about the legislation, but by the end of the process, and I think partly because members were going home and hearing from their constituents about it, 94 senators in this body voted yes on it. One voted no, 94-1. Those kinds of votes almost never happen around here. And it happened because people realized this is a crisis, we do need to address it, and that the bill that we came up with actually made sense because it was based on the best practices from around the country. And so I've come to the floor every single week we've been in session since March 10th to talk about this issue, to urge my House colleagues to act, which they did. And then over the past several weeks to urge that the House and the Senate versions be brought together. That happened yesterday. So finally, from March 10th till now, going back and forth, finally, we have what's called a conference committee report, meaning that the House and Senate versions have been reconciled, there have been compromises made, changes made, and we have one bill to go back to both the House and Senate for a vote and go to the President for his signature, and most importantly, to get to our communities, to begin to provide more help on prevention and education, on recovery, on treatment, helping law enforcement, stopping the overprescribing of drugs. It's a comprehensive approach to have the federal government be a better partner with state and local government, with nonprofits, to be able to address this issue that, unfortunately, millions of families in America are now facing. I want to thank the members of the conference committee. That would be on our side and the Senate side, Senators Grassley, Alexander, Hatch, Sessions, Leahy, Murray, and Wyden. I also want to thank all the House conferees. They did some good work. And I know each one of those members I just mentioned has a real passion for this issue. They care about this issue. And frankly, I want to thank my co-author, Senator Sheldon Whitehouse of Rhode Island, because he did a pretty good job talking to the conferees on his side of the aisle, as some of us did, including me, talking to the conferees on our side of the aisle. Senator Whitehouse and I started this process over 3 years ago. We had 5 conferences here in Washington, D.C. We brought in experts from all around the country. And so, yeah, we have a real interest in getting this done. And I commend him and congratulate him for this result as well. I know that those who are in the advocate community, in other words, people who work in this field every day, prevention or treatment, law enforcement folks, healthcare folks, are also very happy that this conference report has come together. And as Sheldon Whitehouse and I believe, we are very happy that this conference report kept to the substance of the Senate bill and added, frankly, some good elements that came out of the House legislative process. They had 18 separate bills. We had one comprehensive bill. We had to bring them all together. There are now more than 230 groups from all around the country. A lot of these are national groups. Some of these are state groups that have come out in support of this conference report. In other words, supporting the final CARA product. Yesterday, I met with about 24 of these groups, talked about the process, how we got to where we are, talked about the need for us now to act quickly to get this enacted into law, because they are desperate. If you're in the area of treatment and recovery, a professional, you want this help. You wanted it yesterday, and we need it now. These are people we consulted with, by the way, during those 3 years. They all came and participated in these 5 conferences. We also consulted with many others, including the Obama administration. They testified at these conferences. They also testified at the hearing that we had at the Judiciary Committee. They were supportive of CARA, in part because we took their input. We took everybody's good ideas, not Republican ideas and Democrat ideas, but good ideas. We kept this not just bipartisan, but nonpartisan. It'd be nice if we could keep it that way. I understand this is an election year, and that some people may want to score a few political points. But I would hope that having gone through this process in a nonpartisan way, having gotten this great vote out of the Senate, a strong vote in the House, now having this conference report done, which has the right mix of House and Senate, good substance, the policies to be able to make a difference in this fight, I would hope that we would not see any more talk of threatening to block this conference report at the last minute. Now, some of these concerns that people have raised at the last minute are concerns that were never raised on the Senate floor. For instance, some of the conferees didn't sign the conference report because they said they wanted to have the mandatory spending that's in the president's budget be part of the bill. That was never raised as an amendment on the Senate floor. By the way, it was never raised as an amendment in the appropriations process even. It just took place over the past several weeks. So this is new. It doesn't mean that we shouldn't have more spending. In fact, as some of you know, we had a vote here on the floor on more spending. It was about emergency spending, not mandatory spending, which has to be offset with cuts and other entitlement programs or tax increases, but emergency. I believe emergency spending is appropriate because I believe this is an emergency, and I voted for that emergency spending. But many of my colleagues did not. It did not pass. On the mandatory spending side, again, it's interesting because that was never brought up before. But I, for one, would be for more spending. But I certainly wouldn't want to block the new spending we have in CARA, which is a substantial increase in spending, because I'm concerned about having more spending. Every day, we are losing about 129 Americans. This is why there's a group out there called the CARA Families. They came to Washington recently, 129 families representing that one family that every day loses somebody to the heroin and prescription drug addiction through overdoses. Those families are waiting. Some of them are here this week because they're interested in seeing what happens. More Americans are now dying from drug overdoses than car accidents. It's the #1 cause of accidental death. In Akron, Ohio, 2 days ago, over one 10-hour span, this is one city in Ohio, Akron, Ohio, 10-hour span, 2 days ago, 15 people overdosed on heroin. 2 more people overdosed later the same day, after that 10 hours. It included a woman and her 2 daughters, all who were found unconscious. It included a 44-year-old man who died of the overdose. There have now been 55 people just in Akron, Ohio, who have died from heroin overdoses this year. This means they will set a tragic record this year in terms of overdose deaths. The problem's getting worse, not better. On Tuesday, as I said, I was in Dayton, Ohio. I met with law enforcement and treatment service providers. We announced a new program called the Front Door Initiative. Sheriff Phil Plummer was there. He told me that over the weekend in one town, again, Dayton, Ohio, 15 people died of overdoses. No one's immune from this. We've lost moms and dads, college students, grandmothers, celebrities, rich and poor, people of every background. It knows no zip code. It's in the inner city. It's in the suburbs. It's in the rural areas. In the 117 days that have passed since the Senate passed CARA on March 10th, approximately 14,000 Americans have died of overdoses from prescription drugs or heroin. 14,000 Americans. It's time to act. And again, the good news is we had a vote yesterday of this conference committee between the House and the Senate to finally pass this legislation to the House and Senate for a final vote and then getting it to the President and, most importantly, out to our communities. The 14,000, by the way, is not the whole story, as tragic as that is, because, of course, there are millions of other casualties. Fellow Americans who may have lost a job or their entire career, have broken relationships with their families and friends, and I hear this all the time back home in Ohio. I heard it over the weekend when someone came up to me at a parade and said, you know, I'm one of those people who cares about this issue. Thank you for fighting on it. We've had this issue in my family, and it broke our family apart. People say the drugs become everything. And that means the job or the family or relationships are put aside. Others, of course, are driven to theft or fraud to pay for the habit because it is so expensive. We're told in Ohio and most of our counties it's the #1 cause of crime is the heroin and prescription drug issue. 80% of the crime in one county I visited recently, the sheriff in that town and the prosecutor say it's related to this one issue. We don't have time for partisan games here. This is urgent. More urgent, I think, than any other issue we're dealing with. 9 out of 10 of those who are struggling with addiction are not getting the treatment that they need. I think if this were the case of any other disease, it would be viewed as a national scandal. It's wrong and it's unacceptable. Addiction is a disease, and one of the underlying tenets of this whole legislation is to acknowledge that. And with all the specific improvements we have in terms of grants going out for treatment and recovery and prevention, education, helping police with Narcan and so on, the biggest thing, in a sense, for this legislation is to say, let's get this stigma out of the way, let's deal with this as a disease and get people into the treatment that they're going to need to get back on their feet. Again, a few months ago, I, along with others, worked with the Senate Appropriations Committee to be sure that we did have additional funding to fully fund CARA, of course, and to get more funding into the pipeline for treatment and recovery, education and prevention. So when people talk about the funding issue here, let me just be clear. We are increasing funding. The CARA bill itself increases funding, of course, and the authorization. But here's what the appropriations committees have done. The 2015 number was $41 million. This is for the Department of Health and Human Services, discretionary spending for heroin and opioid abuse. Went up to 136 for this year. That's the year we're in now. That's a 237% increase. Next year, for 2017, if we can get CARA passed this week or next week, this is what would apply. We're seeing a 93% increase from the 237% increase. That's more funding. I wasn't great at math in school, but that's more funding. In fact, it's a 539% increase from 2015. So for those who say we're not taking this seriously enough on the funding side, of course, I would like to do more. But we have to acknowledge that a lot has been done. In terms of the overall spending, not just the HHS spending, we've also seen increases. This would include Department of Justice and other grant making. We've seen an increase from 41 to 136 to 262 in the Senate appropriations. I'm sorry, this is to add the House version of the appropriations for 2017. So for next year, again, in the Senate, we have a big increase that will start on October 1st if we're able to pass our appropriations bills, whether it's a CR or an omnibus or whatever form it takes. This is what the increase would be at a minimum, I would hope, because that's what's passed out of the Senate Appropriations Committee. This is what this week the House reported passing. So as big as this increase is in the Senate, again, a 93% increase from this year's increase. In the House, it looks like, from what we've seen, from reports from the House Appropriations Committees and conversations with them, they're talking about a 393% increase in 1 year. Again, this is the House Appropriations Committee. 1,500% increase over, again, 2015. So for those who say there is not new spending being dedicated to this, of course there is, and that's good. With regard to the total discretionary spending, this is not just HHS, but all the different areas, including Department of Justice and so on, we've also seen an increase. And this is the Senate only. We don't have the House number yet. But for the Senate, we've gone from 220 to 320 to 470. 113% increase over last year's spending. So we are seeing more spending, and that's good. And by the way, this spending is connected to the CARA legislation. This increase was increased with the provisions that were in the CARA legislation to be sure that the two matched up. Finally, this is the increase that we got in the conference committee for the amount that's authorized. Not the actual spending, but the amount that this place, this Senate, this House would authorize for increased spending for these new programs in CARA. The Senate passed bill, again, 94-1, had a $78 million per year increase. The conference report more than doubled that to $181 million. So here's what's interesting to me. There are senators on this floor who voted for CARA because it was the right thing to do. A nonpartisan exercise with a lot of bipartisan support, 94-1 vote. All that's changed since then, is that we have a more than doubling of the authorized amount of spending in CARA. And with regard to the appropriations process, because we didn't have this appropriations in place then, the Senate committee had not acted, the subcommittee had not acted. In those 117 days since CARA was passed, we now see a 46% increase overall in the discretionary spending, and we see, with regard to HHS, which is where most of the treatment money is, a 93% increase, or the House version, it looks to be over 390% increase. So all that's changed since CARA passed with a 94-1 vote were these big increases in spending. Again, I voted for emergency spending on the floor. I think it's an emergency. I would go further. But for those who say they now can't support this good legislation because of spending, it makes no sense. There's no way to argue that. There must be some other reason. I hope it's not politics. Again, that's what people hate about Washington. If partisanship is going to slip into this at the end of the process here and keep people from getting the help they need and save lives, that would be a tragedy. These new spending programs will help. But we also have to point out that CARA is not just about spending, it's about authorizing better programs. There are lots of examples of that where we have done that in this body in other areas. I'm the author of the Drug-Free Communities Act. It authorized spending to create anti-drug coalitions around the country. It's helped spawn the creation of 2,000 coalitions. I founded one in my hometown of Cincinnati over 20 years ago. Another 2,000 have benefited from that. That legislation did not have an appropriation because it was an authorization, as CARA is, but it set up new programs, as CARA does. To date, that program, Drug-Free Communities Act, has spent $1.3 billion focused on prevention and education on drugs. We have more prevention and education programs who think they're even an improvement in the CARA legislation, but that's an example of what an authorization bill does. Back in 2013, the United States Senate voted to reauthorize a bill called the Violence Against Women Act. I voted for it. Every single Democratic member of Congress voted for it. It passed the Senate on a bipartisan basis, 78-22. The bill increased authorizations to $655 million annually and made policy changes. But it did not, and I repeat, it did not include the spending in the bill. It was an authorization bill. The spending bills come with the appropriations process. It didn't have mandatory spending. It didn't have immediate appropriations. It was an authorization bill. An incredibly important issue, violence against women, a priority. And yet we didn't see some of these same concerns raised. Nobody voted against the Violence Against Women Act because it didn't have appropriations attached to it. That just wouldn't have made sense, as it wouldn't for any other authorization we pass around here. I know that wasn't an election year, but we voted for it, and then we fought for the funding as part of the appropriations process, and we were successful in doing that, just as we will be successful in fighting for these appropriations, as we did this year, getting a big increase, 237% increase, and as we will for next year, as we see already, thanks to our advocacy, those of us who are focused on this issue, we're getting the increases to cover these changes in CARA. All the funding in the world, of course, isn't going to make a dent in this issue if it's not spent the right way. And that's why you have the authorization bills like CARA. Because we actually say, not just for the new spending, but even for the existing spending, let's spend it in a way that's evidence-based, where we actually look at what's working and what's not working in treatment and recovery. The number of people who relapse is shockingly high. The success rate is not what any of us would like it to be. Part of that is because some treatment and recovery programs work better than others. We want to be darn sure that the tax dollars we're putting against this are being responsibly spent, because we are good stewards of the taxpayers' dollars and because this crisis needs to be addressed. So again, this legislation is not just about more money, although it does authorize more money, and that's good. It's also about changing the way we spend the money so that it goes to evidence-based prevention, treatment, recovery programs that have been proven to work. That's why we can't let a debate about funding jeopardize the critical policy changes that CARA would make. And because CARA would help ensure that these new resources would be spent on what we know works. That's what this 3-year process was about. That's what the conferences were about. That's what all the expertise coming to Washington to tell us what works back in the states was about, getting those best practices into this legislation. Again, the CARA legislation improves prevention by sponsoring a national awareness campaign about the dangers of abusing prescription opioids. Probably 4 out of 5 heroin addicts who overdose today started on prescription drugs. That information needs to get out there. We need to explain to people this connection if we're going to get at this issue. The legislation also targets anti-drug coalitions in areas where the epidemic is worse. So where it's at its worst, there is more funding targeted to these anti-drug coalitions to focus on prevention and education. That's key to keep people out of the funnel of addiction, the grip of addiction. We should all be for that. That's in this legislation. It would increase access to treatment by increasing the availability of naloxone, which is a miracle drug that can actually reverse an overdose while it's happening. It will train our first responders to be able to use Narcan or naloxone more effectively. These provisions will save lives, particularly when it's connected, when saving a life is connected to getting somebody into treatment. The conference agreement would also improve recovery for those who have been treated for addiction. It will build recovery communities like the ones at colleges and universities, perhaps in your state. At Ohio State University, we have one we're very proud of. These communities, recovery communities, will give the peer support that is necessary to follow through on addiction treatment over the long term. We know that works. That's one of the keys here, not just the treatment, but the longer-term recovery to keep people heading in the right direction. This legislation is comprehensive, so it deals with all of these issues. It's improved in the House by raising a cap on doctors being able to have a certain number of patients when they're prescribing Suboxone or buprenorphine. That's in the legislation as well. That's an improvement in the legislation since it left the Senate. I know Senator Markey and others feel strongly about that. I do too. I think people in your state, people in Ohio, certainly understand the urgency of this problem, because everywhere I go, whether it's in the city or the suburbs or the rural areas, people ask me about it. And they ask me why we aren't doing more, why we're not acting on this. In Southwest Ohio, my hometown of Cincinnati, 2 weeks ago, a 28-year-old was arrested after a young man in the Cincinnati area who bought heroin from him was found dead of an overdose. A 17-year-old teenager was found dead of an overdose. That's what's happening on our streets today. A few days ago, a man from Canton, Ohio, was pulled over in Akron in northeast Ohio for speeding. He had 13 pounds of heroin on him. By one measure, that's about $400,000 of heroin, enough for 20,000 injections. If not for that apprehension, we would have had a lot more distribution of heroin, overdoses, potential lives lost. In Madison County, in central Ohio, police just arrested 16 people for trafficking heroin. At one of the drug houses they went to, there was a 5-year-old child. That's what's happening. According to the sheriff's office, 90% of property crimes in that county are directly tied to opiate addiction. 90% of the property crimes are people committing theft to pay for their habit. Sheriff James Sabin says that out of all the problems facing law enforcement in central Ohio, heroin is the #1 issue we're dealing with. That's what's happening. Ohioans know this is happening to their friends, their neighbors, their family members. They understand the urgency of this crisis. That's why all over the Buckeye State, people are taking action at the local level, the state level, but they want the federal government to be a better partner in helping them to do what they know has to be done to fight this epidemic. As I said on Tuesday, I was in Dayton. There have been over 400 overdoses just this year in Dayton. By some measure, Dayton, Ohio has been named as the top big city in America for overdoses. Not something we're proud of. These 400 overdoses are going to be helped by a new program that was just launched and announced on Tuesday. I was there for the announcement. It's called the Front Door Initiative. It'll get treatment to those who have overdosed. Once they're clean, get them skill training, help them find a job, teach them how to be better moms and dads. The notion is, instead of putting people into prison, to get them into treatment. It's a diversion program. that is going to be customized and personalized for the particular person's problems, because we have found, again, through looking at what works and what doesn't work, that that's an effective way to get people back on track. This innovation is happening in other places too around Ohio. Sheriff Tharp, Lucas County is doing some very innovative stuff, again, connecting people to treatment who they're arresting. In my view, it's going to be more effective, more compassionate, and it's also going to save taxpayer dollars. I want to thank Sheriff Phil Plummer, the Cornerstone Project, and the entire Montgomery County Drug-Free Coalition in Dayton, Ohio, for their daily fight to get treatment to those who need it, helping people get their lives back on track. The conference report, again, that's just been voted out, will help these law enforcement agencies like in Dayton and in Lucas County and in other places around Ohio to be able to find alternatives to incarceration. Ohioans are taking action, and they expect Congress to take appropriate action too. This is a crisis. They want the federal government to be a better partner. They've been patient. Let me just say respectfully that in my view, this is not like every other issue we address here. We address some very important issues. And we did yesterday on sanctuary cities or issues that relate to the spending bills. But this is about saving lives. And it's about allowing people to achieve their God-given purpose in life by not getting off track, by not being casualties of this addiction epidemic. I think this is urgent. And for those of you who might say, well, what hope is there? How can more money help? I will tell you, one, it's money that will be wisely spent. That's how it will help. But second, that if it is well spent, treatment can work, and it does work. Recovery can work, and it does work. There's so many stories I can tell you of this because I've been at over a dozen treatment centers around Ohio, spoken to hundreds of recovering addicts, heard so many stories. Let me tell you one. It's about Bethany Temples from Prospect, Ohio. When she was 18 years old, her dad died of cancer. To help her cope with her grief, she tried one of the painkillers that he had been prescribed. So he had pain medication for his cancer. She was in grief. She thought, well, I'll try one of these painkillers. She became addicted to these painkillers. Soon they were too expensive and not as accessible as something else, which was heroin. She became addicted to heroin. While she was addicted, she gave birth to a daughter who was dependent on opioids. And by the way, there's been a 750% increase in these babies who are dependent on opioids being born in Ohio in the last 12 years. It's tragic. Her boyfriend got into a car accident while he was high on heroin, and he died. Bethany was eventually arrested. And fortunately, she was in an area of Ohio where she not just got arrested, but they helped get her into treatment, diverted her into treatment. She got help. She was the very first graduate of the Marion, Ohio Court Family Dependency Treatment Program. Family Dependency Treatment Program. It's a drug court. We had a roundtable discussion in Marion with Bethany and others and got to see some other young women who have been able to benefit from that. Her daughter got treatment too, by the way. They're both now healthy. Not just healthy, but Bethany is now a college graduate. She's now married. She now has 2 kids. She's now the coordinator of the same program that got her back on track, as she would say, saved her. She's the coordinator there, and she's helping others to get their lives back on track as she did. She's beating this because she got the right treatment for her, the right recovery program for her. Mr. President, this is personal for me. It's personal for all of us. It should be. I know too many people who have gotten caught up in this grip of addiction. I know too many families who have gone through what may be viewed by some as the ultimate grief, which is to have your child predecease you because that child got involved with prescription drugs, then heroin, then overdosed. 2 families that I've gotten to know lost a child because when their wisdom teeth were taken out, they were given pain medication, and they got addicted to the pills and then heroin. Teenagers who had to have their wisdom teeth taken out. These families are waiting, but they need help, and we need to give it to them. I would urge my colleagues to set the politics aside. This is not a partisan issue. It hasn't been from the start. This is an issue of helping the people you represent. For all those people who voted for the legislation as it came through, 94-1, remember, all that's changed is there's more money in this bill now than there was before. Remember, in the 117 days since you voted for this legislation, over 10,000 Americans have died, including Americans in your state. Remember, there's an election every 2 years. There's always going to be politics. This needs to come above politics. We need to get this done, and we need to get it done now. I yield back, Mr. President.